Welcome to this Asia Global podcast, brought to you by the Asia Global Institute at the University of Hong Kong. I'm your host, Alejandro Reyes, the Institute's Director of Knowledge Dissemination. In our programs here in Hong Kong and online, and in the content that we produce, we focus on presenting Asian perspectives on global issues. This podcast is part of our Meet the Author series, where we have a conversation with contributors to Asia Global Online and other publications of the Institute. Joining me now from Nairobi, Kenya, is Michael Seo. Michael is a social entrepreneur and consultant who in 2018 launched ReaMedica Health, a private health clinic in Kenya serving vulnerable populations. He has contributed research and writing to Oxford Analytica, Stanford Social Innovation Review, The Economist Intelligence Unit, the Huffington Post, Kaiser Permanente International Accountability Lab, and Fast Company. He holds an international master's degree in health leadership from the Desautels Faculty of Management at McGill University in Montreal, Canada, and a Master of Science from the London School of Economics. He's also an alumnus of the Global Leadership Fellows Program of the World Economic Forum. Michael, very nice to see you. Welcome.
Pleasure to be here. Thank you for having me.
Yeah, great. Now, in your article, which is still trending on Asia Global Online, you write about how COVID-19 has decimated populations and overwhelmed health systems around the world. But of course, the pandemic has also accelerated innovation efforts as dire consequences, dire circumstances are increasing the urgency of change and the willingness of entrepreneurs such as yourself to sort of conduct high-risk experimentation. And as I mentioned, you launched in 2018 a private health clinic in Kenya serving vulnerable populations. So really there are three things going on here. There's the pandemic, tech innovation, and the empowerment of women, the importance of not just providing healthcare services for women, but also promoting and supporting women entrepreneurs in healthcare, ensuring that business models, operations, procedures are designed for women. And that usually means that women should design them themselves. And then there is, of course, as I mentioned, COVID-19, which has had a catalytic effect on digitalization and underscored the need to strengthen healthcare systems and for greater innovation. So really tell us what it is you're doing in Kenya, because it is really interesting and fascinating and difficult, I'm sure.
Well, thank you. So I opened up a for-profit social entrepreneur clinic, which uses a nurse-led model. And the reason that we use a nurse-led model is that the majority of the health workforce are actually around nurses and the services they provide to the general population. And so what I tried to think about in terms of low resource settings is where do you have the most resources in that type of setting? And to take a point of strength in terms of numbers and then accelerate their impact by increasing the support that you can give to them. And then they can further provide access and more efficient support around the current assets that you have. So we specifically designed the model, and we is my staff of nurses, and the lead clinical nurse has been working in both the public and NGO sector as a Kenyan for 18 years now. So I was very fortunate to be working with Penina Mulwa, who helped us design our service delivery model. And one of the things we do, which is a bit unusual, is to train our nurses to perform pregnancy ultrasound scans. So through that, we're able to provide services at about 30% less than market rate. However, I think the fundamental point of this experimentation is that we're not trying to prove clinical efficacy. What we're trying to do is to take something that's already been proven and expand the access of those types of services. And I think that's where a key part of innovation is overlooked,
Right.
is that you have tools and efficient mechanisms that already have been proven to work. Now, can you scale that? Which is a very different challenge from a completely new innovation of introducing an intervention that doesn't exist.
Right. So in many ways, you're sticking to, in some ways, the real classic definition of innovation. In other words, some creative idea, some notion, proposition, as it were, that you've translating into really a commercial endeavor, right? Something. So it's not necessarily anything new, shiny, or a new product or what have you, but you're just trying to scale up and make profitable something that already has been proven and understood in healthcare, right? Now,
that's correct. And I think the profitability part, depending on the vernacular and the audience you're speaking with, is often referred to as financial sustainability.
right.
And I think that, when you look at the small and growing businesses, particularly in Africa, you'll see that a big majority of that, or a large portion of the social entrepreneurs and such, and small growing businesses are actually entrepreneurs that are subsistence entrepreneurs or small growth businesses. And what I mean by that is, you'll see that a founder may grow a small business and then hire 2 or 3 typically relatives who are employees, but it never gets beyond that stage.
Right.
And I think that there are many good reasons as to why that occurs, but in terms of scaling an operation or getting to a small growth business that grows beyond 3 employees is really very, very difficult. I mean, there are challenges that change as the path and development of an organization grows, right? So the challenges aren't stagnant. And I think the fluidity is such a difficult thing to overcome,
Right.
because as your needs grow, they also change.
Right. So then tell us where at what stage are you, and so describe your operations right now. Maybe where you. I mean, you mentioned you started out with this veteran in healthcare, nurse. Where are you now? How big are your operations?
So we actually had a clinic on the east coast of Kenya in Mombasa, and we closed that down actually last year. And I've now joined with Panina, a Kenyan woman doctor, and we're starting an occupational health services clinic and service near the airport. So the model has changed dramatically in terms of focus, because the realities of the marketplace, especially with the pandemic and health services, has been quite tumultuous. We are continuing with the nurse-led model of obstetric or pregnancy ultrasounds, but we're using a subsidized model because the challenges around making that sustainable without donor support is really much more difficult than I had anticipated. So, I think part of the article came from my own experiences, one as having a staff that was predominantly Kenyan women, and then now the evolution of actually partnering with Kenyan businesswomen. So the team that I'm partnering with, Dr. Harriet Muigaigwa and her sister Eva, one is a doctor and one has a finance background. And so it's really quite a pleasure to be working with them, but the dynamics of the relationships and also seeing the potential of these women and the skills that they have just reinforces my thoughts that we need to invest more in supporting women entrepreneurship and innovation.
Right. So bring us again into what you do. What is happening? What's happening on the ground in terms of the work that you're doing with these 2 women?
Sure. So we are opening up a clinic in the airport security area, in the international airport security area, and they're focused on occupational health and safety. And this is actually the second clinic that they've opened.
Right.
So having that level of experience is just tremendous. Right? So we're bringing forth those services that are targeted toward companies, toward employee schemes, toward national insurers. I would say a much more classic model of healthcare provision and billing and revenues.
Right.
With regard, in parallel, I'm still running the nurse-led ultrasound scanning. And so we finished 2 pilots. One pilot was with the Farm Access Foundation of East Africa and the Phillips Foundation. Concurrently, we ran a pilot with the Murang'a County Department of Health, which is the county which borders Nairobi. And during those 6-month studies, we looked at 2 different things, overarching objectives. One is the price sensitivity of providing ultrasound services for pregnancies. And then the other was specific to accessibility. So we priced our services at approximately $8 per scan. That price is in direct reflection of what the public health system charges for a pregnancy scan. So what we weren't trying to do is to disintermediate a system. What we were trying to do is to see if we can work within the parameters of the existing system and expand the accessibility of these services with the underlying aspect of improving the quality. So there's an aspect of access, quality, and affordability. What we found, which I think was really fascinating, is that 95% of the ultrasounds that we did going to the vulnerable populations, 95% of the women we scanned had never had an ultrasound scan before.
Right.
We also found, which was very interesting, that the indigent population, which was accessing the public health system, to ask them to collect the equivalent of $8, you needed to give them more than 1 week to collect $8. So that can show you what, if there is actually any price sensitivity. I think the irony with most programs that are targeting women, and this is in agriculture, health, anywhere in low resource setting, but predominantly, for example, in agriculture, women produce more than 60% of all the food globally in production. Yet, as you go up the value chain from subsistence crops to, say, high value crops such as coffee that is sold, the further you go up, the less participation and ownership of those assets that you see women actually having. So that's the paradox, right? And so for us, with back to the pilots, is that we were looking at both the price sensitivity, if there actually was any elasticity, how we underpin everything we do in terms of metrics and quality, and be able to report that, because you can't report what you don't track, right? It's very hard to retroactively do that. And then the other, I won't necessarily say it was the innovation, but the experimentation that we had was working directly with the county chief nursing officer and her team. And so, not by design, but 90% of the input that we had in terms of services, feedback, was all female-led.
Right.
Everywhere from Farm Access to the Phillips Foundation to the Murang'a County Department of Health to our team. So that was actually not by design, but I think was really compelling in that you see that actually the talent and the resources and the opportunity to interact with female leadership is something that more effort needs to be put upon. You really have to do it. And the lesson I learned is to actually design this much more with a gender parity mindset.
Right. Now, I mean, this is reflected in many aspects of life, right? I mean, I think about how in the issue of, say, water management, water access, that often it's the women and girls that do all the work, but then when it comes to the actual management of water resources, the men are in charge, right? So that there's that asymmetry. Women do all the work, but then they often they will not have a say in how water gets allocated. So is this the same then in what you've seen in healthcare, that the healthcare systems are essentially, particularly when targeting women, that they're not really designed for women or taking women into account, both on the user and on the provider side, I guess, because you mentioned that it was important that if you have a nurse-led system, that the nurses themselves should feel safe going to visit patients.
I'm sorry, you broke up on the last part. Could you just
No,
repeat that?
no, that both on the, the issue is the design of your system, your business model, what have you,
Sure.
that really there has to be input from women, that's important. And you stressed in your article in particular, which struck me, is that in your nurse-led model, you have nurses, you're not just thinking about the patients themselves, the women who are being served, but you're also thinking about the practitioners, because when the practitioners go out on visits, they need to feel safe in the places that they go to. So that's also very important, particularly if your practitioners are mainly women,
Yes.
are all women.
So
right?
actually, absolutely. So interestingly enough, when you bring up the example of water, I think that really solidifies the anxiety and the fear that you have in terms of vulnerability of women and the tasks that they're undertaking every day. Because for example, in the collection of water, a woman or a young girl most often is the most vulnerable at the time she's actually bringing the water back home, because she has a very heavy burden. And there's very horrifying statistics at the prevalence of attacks that happen when in these rural communities that women are going, or young girls quite often, are going to collect water or firewood or things and bring them back home. So the safety aspect in that regard is really astonishing and quite honestly, very, very surprising. With regard to the service model and design, there are definitely two aspects, as you point out, right? One from the provider side, and then the other from the patient side. And so, safety goes hand in hand with trust, right? First, you have to have the trust, because if you are going into an environment in which you feel unsafe, you won't be able to focus on your work with good reason, obviously. So as much as we can, the environments that we are interacting in, we try to do, I wouldn't call it a safety assessment, but we try to make sure that we've done our background. And so, for example, with Dr. Muithaiga and Health Connect, what they do is to vet the person or the patient requesting the services of the health provider or specialist that's going to their home. And then on the other end, the whole aspect of financial security and stability. So one of the challenges of many of the emerging health systems is the ability to pay on time. So the services or accounts receivable. So the services that you provide, many of the strikes that you see on a national level with the nursing associations and county level is because that they haven't been paid in 3 months and they continue to work. It's certainly understandable that the sense of hopelessness and the sense of, I'm doing the work as requested, but I'm not being compensated in a manner in which I'm delivering you the services.
Right.
You ask and I deliver, but I also expect that reciprocity in terms of the provision of the value that I'm giving you.
Interesting. Now, tell us a bit more then about being an entrepreneur in a place, I mean, you're far away from home, and so you know, the challenges that you face, but also, I mean, and I think probably more importantly, the challenges that your colleagues, the women entrepreneurs face in Kenya, which I think are probably reflected in the challenges that many women entrepreneurs face in developing and doubtless in developed economies as well.
Yes, so actually the challenges that I've been facing here, and it took me a while to accept the realities of being in kind of an unregulated market. I mean, I do understand that there is a government, it functions, and there are the structures, but quite often you see that there is a lack of enforcement. And so I've written about this in Accountability Lab and several times for them. And what I think is really detrimental and is really hard to overcome is that you have a lot of, well, some would call it corruption, some would call it inconsistencies. But if I take it to my work specifically, looking at a value healthcare based model, right? Values-based healthcare fundamentally provides predictability. And with predictability, you need transparency and adherence to a general set of either reporting or procedures, which is known and agreed upon by all parties. And I do not know, quite honestly, if it is, you know, some part colonial legacy, some part that you're in a low resource setting, and some part that there's no enforcement. I think it's a combination of many of those factors, plus the urgency of just trying to survive. But what I've been most shocked at is the level of how competition manifests itself here. And so, at least in some of the clinics, as we were trying to provide our services, and this goes also for governments as well, or government agencies, competition wasn't about trying to provide a better service. Competition literally was trying to destroy the competition. So, you know, I had from various agencies, in 1 year, we had over 15 inspections. Thank goodness I had all of the documentation and overabundance of licenses and certificates, because after the first 3 or 4, you understand that you are, well, a favorite target in many ways. The other part is that, you know, we had instances in which we literally had our electricity cords cut. We had our cable knocked out. We had equipment damaged and stolen. And some of this came from disgruntled employees. Some of it came from other competitors, you know, that we tried to partner with. And then there's also the aspect that in many ways, when you are trying to do things in a manner that's not necessarily prevalent in the environment you're at, it can either be perceived as a threat or as something to partner and hopefully see how that can be augmented to the realities of the other businesses. And to be fair, you know, my naivete of doing things in the manner I'm accustomed to, I don't want to use the word the right way or anything like that. This is not a quixotic episode. This is merely when I tried to avoid the corruption and such, I did this from a level of self-preservation. Because once you engage in an activity which may be a little bit dubious, you open yourself up to vulnerabilities that you can't defend against later.
Right.
So in terms of getting a license, for example, it took me nearly a year to get our facility license. for a myriad of reasons, some bureaucratic and some less bureaucratic. But there are challenges, I think, that in the emerging markets, and certainly as a foreigner, that you just can't anticipate.
Right.
And some of it you just can't overcome.
Right. And then about, women themselves, women that you're working with, the challenges that they in particular encounter in terms of trying to create a working enterprise, indeed a social enterprise, which one might expect people would welcome, but then uh, and of course women being more than half the population generally, they are a great resource of entrepreneurship and innovation. So as much as any segment of as men, I mean they're just we in many ways underutilized. It's an untapped resource that needs to be promoted, and that we need to promote. And there are clearly obstacles for women in terms of in their becoming entrepreneurs and their launching enterprises and scaling them up.
Absolutely. So I think one of the, for any entrepreneur, certainly access to capital. But if I drill this back down to the gender biases, both in terms of the review of the financial systems and the applications that women and men have, and then who's actually reviewing those applications, right? So if you go to a commercial bank or even to, a money lender, they're going to see there are just one implicit biases of, okay, it's a woman. And I can attest to this from, I've been to several business meetings with Dr. Muithaiga as we launch our new business. And she is a very well-respected doctor. She is known and she has contacts. And so some of these meetings I've been able to take with her. And honestly, I am just shocked at the tone in which she is being addressed and the lack of credibility that one is given. And I think that also permeates the processes and biases when you are looking at, for example, support around financing. But I think also one of the most difficult challenges is that in terms of supporting women entrepreneurs and innovation, it's a different set of evaluation objectives and metrics. And also, you need much more longitudinal support. So while I do applaud and had participated in incubator programs, which were about 6 months and such, you really need to be supporting enterprises, and particularly women enterprises, for 24 months at a minimum. Because many of the things that you regard as essential to running a business, because it's different running a business than actually doing the work, right? Per se, of providing the services in a direct manner. So if you're selling fruits and vegetables, it's different than procuring fruits and vegetables from a farm, then having that in a small shop and then managing the finances of the shop.
Right.
So the support, the design of the support, and also the length of the support, I think needs to be reevaluated in a way that reflects the risks and the inherent challenges that women face as entrepreneurs versus men.
Right. Now, is there much institutional support? I mean, was there much institutional support, whether from NGOs or civil society organizations, financial institutions, perhaps, that were able to help the women that you're working with in building their enterprises or their
so I've actually seen some microfinance funds,
right,
which were started on a very local level, which were started by some women. and are very specific to women lending, but those are far and few between. I think you have programs such as the IFC and the World Bank, which have very gender-centric programs and program support. But the size of the deal is a hurdle, right? So to reach the women that are really starting from the ground up, with literally a table in front of them, sharing their wares or their services, it's the dilemma, I think, always of deal making, because when you're evaluating and supporting the various options, everybody wants to look for scale, which is understandable. So I don't know how you actually reconcile helping entrepreneurs at a very nascent stage who need much more support and research support and guidance.
Right.
But then your return is typically smaller in the short term, and then you need a much longer window of support to get to a level that, supporting, for example, a male business that is a little further along. So I don't know how to reconcile that, those various objectives.
Well, this strikes me as being a sort of really classic problem, because I mean, as long as you and I have been involved with the World Economic Forum and a lot of the discussions that they've had there over the years, and I mean, I think from as far back as I can remember, the issue of how micro, small, and medium enterprises can get financing and support has been an issue, right? I mean, because there are many issues of the risk, the need, the issue of the size of the money required, all of the things that you've mentioned. It strikes me as on the ground, there's still, this remains a conundrum. This remains a perpetual problem that I'm not going to be negative and say that there doesn't seem to be real solutions that are happening, but that remain intractable, these problems, and one wonders, well, what can be done? I mean, do you have any ideas in terms of, well, how can we really get to the nub of the problem?
So actually, one of the things that we had undertaken when the pandemic first appeared in force in about March and April of last year is that I understood from the ground, we were seeing that prices of basic foodstuffs were going up dramatically, fuel. So the basic costs of living in Mombasa were accelerating very, very rapidly. And so the normal, I won't call it budgeting, but the normal sequencing of how one handled their monies was suddenly at a bigger deficit, unanticipated. So what we did was we advanced a little bit, not advanced, but we paid a bit earlier the next month's salary, but then we sat down with them and actually ran through a very basic, not Excel spreadsheet, but we asked them, what are your finances? What are your expenses on a monthly basis? And let's sit down, given what your salary is, are you saving anything? So we tried to do a little bit of personalized financial management, just to say, this is not the norm anymore in any sense, in what you're going to spend and the prices that you're going to be seeing on the marketplace. So let's figure out how you will manage your own finances and your family finances. So that was one thing we did. But I think also in terms of microfinance lending to women and businesses and just small growth businesses, and I'm not sure the legality of it, but I think that you need to, or one of the mechanisms I could see is that with the lending, you have a clear objective in terms of creating new jobs that are beyond your immediate family, right? And if preferably, if you can, to have some type of mentoring program with women and the women leaders. Again, these are all very difficult things to do, right? Because
Right.
they don't necessarily generate revenue straight up.
Right.
But as you said, the intractable conundrum is, how do you support longitudinal growth when you have the immediacy of, how do I keep my business running?
Right. And for women, the challenge is even exponentially greater generally, usually.
Yes, and the thing is, when you see also, there's quite a bit of literature as to women versus men in general being a much better investment, right? Return on your investment to support. Because also you'll find that, for example, women will spend as heads of household, in addition to being a full-time employee or an entrepreneur, is that most often you'll find that women spend a substantially greater portion of additional income that they earn towards the family and the household than a male would. So that type of knock-on effect in a very powerful, impactful way improves the household finances, improves typically the health of, if they have family, a child and such. And so those are investments which are hard to track and even harder to quantify.
Right.
And I think if there were more research around that, that would be fascinating, because I'm trying to find those type of statistics, and there's quite a bit of general anecdotal accepted information, but not very specific research that would support those type of indications.
Yeah, no, so indeed, it would raise the question as to whether, that anecdotal evidence, or whether there's real, the real evidence does actually affect policy. Because if policymakers don't recognize and accept that women, in fact, are less risky bets than men, then that should influence policy. That should influence the behavior of financial institutions. But at the moment, again, maybe I'm being a bit cynical, but it just strikes me as that even though people do recognize those truths, that they don't really act on them. They don't really, they aren't really manifested in policy or behavior of financial institutions.
And from what I've seen, I think you're 100% spot on. And oversimplification, but to do that, it's hard, right? And I hate to use this term, but it's not sexy. It's not, what is the next leap in AI application technology to vulnerable populations? It's not that. It's actually very on the ground, task-driven, tracking, support, quantification, and then research and reporting. And then from that aspect, if you do put in policies, the other part is there has to be a greater level of consistent communication. And you see this in the pandemic, right? With disinformation and constantly communicating consistent and valid information. I think for women entrepreneurs and women-led on innovation, that's the same challenge that they run into. Is one, you need to show the successes, but it's hard to find them. Right. And then you need to be consistently communicating them to policymakers and advocacy groups. But also the other part is you need greater leadership development to place women in those positions. And I think the irony is that I'm speaking about this, right?
Well, we're speaking about this, right? No, indeed, I think one of the issues, and I think this is true of Africa, but it's true of many other regions, developing regions of the world, is where are the narratives? We need the narratives. We need the storytelling.
Yes.
We need to understand what's really going on. And often the information that we get in our elite towers of learning is maybe a little bit too filtered.
Sure.
Somewhat. Now, you describe the pandemic situation as tumultuous. What's the situation over there? And then in terms of just the general overall situation in Kenya, but how it affected, and you've already alluded to some aspects, but how has it affected the work that you're doing and the work that the enterprises that you're involved with are doing?
Sure. And I think obviously the pandemic has disrupted everything everywhere, right? And both from the need side and I'd say what the pandemic has done most in terms of policy and funding is it shifts the priorities. And so the immediacy of supporting programs that are directly related to the pandemic, one as prophylactic and then hopefully more as curative eventually, that takes a tremendous amount of resources. And I would define, I think the key thing here to consider is the separation of resources I'm talking about. So there has been certainly more monetary support overall, and then a good portion of that has been directed toward the pandemic and COVID, et cetera. However, you have a finite set of resources, meaning intellectual capital, as well as professionals and talent, whether it be finance, business, or health. And that really is very finite. So while you may be able to expand the financing of initiatives, it's very hard to expand the talent capacity that you need to implement these programs. And so what you are forced to do when you change your priorities is to take a limited set of resources and say, I need you in room A instead of room B.
Right.
And that, I think, is the inelasticity of the resources you have faced with a deluge of other funding that may come in. But then how do you focus that? And naturally, there's going to be, what do we need to address immediately in the next 30, 60 days? And I think also you see that just generally on the ground with the fact that so much is happening so quickly. For example, with the vaccine rollout. One of the things that we're looking at is we're investing in molecular diagnostic testing that's specific to PCR tests, but also more broadly around molecular testing in the future. However, for us to get our qualifications and certifications, we are in a process which is actually evolving as we speak. So one agency that we need certification from actually doesn't have any more trainers who are training for certification. So now we're trying to find, where do we get certified trainers to certify our personnel to administer these services? And it's not, I think, any conspiracy or such. It's just really that they're handling so much that often the right hand doesn't know what the left hand is doing.
Right. So indeed, this brings right to the ground sort of insight on what can happen when there is not enough capacity within a healthcare system, right? I mean, and it need not be right at the coalface, as it were, in terms of doctors treating patients, but it could be some kind of bureaucratic function that might not be working properly.
Absolutely. I mean, I think if you take a look at the example of PEPFAR and the HIV/AIDS epidemic,
right?
When you think of health system strengthening on the continent of Africa, I think rightfully so, a lot of credit is given to those programs and the investment made in terms of diagnostics, in terms of testing, in terms of building up personnel, but not necessarily doctors, but health workers and that type of lighter touch infrastructure. And you can see that, 20, 30 years it is taken to get to a level of diagnostic infrastructure, which I'd say Africa is actually, certainly there's scarcity, but I think Africa has done pretty well in terms of the challenges that they faced. And I think that if you ask most public health officials and such, you can attribute that to the investments that were made on a very substantial level trying to address the scourge of HIV/AIDS.
Right, right. Now, what are your plans for the future then with the enterprises that you're involved with and your own work there? Are you planning to stay engaged in Kenya?
So, sorry, the future of the enterprises that I'm involved with
Yes,
now?
and then your own plans. Are you planning to stay there engaged in Kenya, or are you wanting to create more enterprises? You're a great traveler. You move around.
First, I want to just make sure that what I embarked upon with the nurse-led model has some growth and sustainability behind it. Right. This is that's very, very important to me because that's the initial objective that I set out upon. And secondly, I think that working in the airport services or occupational health and safety with our new clinic, we want to be able to grow that business, and there could be some type of cross-subsidy model. So we're not dependent upon donor money or anything like that to keep the lights on, although I think there's a particularly impactful place that funding like that has to be very, very catalytic to absorb some of the risk in taking the innovations that are presumably necessary, but yet to be proven.
Right.
And then also I would like to actually focus on expanding the diagnostic capacity and the human resource capacity professionally. So one of the things that I really would love to see is that to develop localized content in terms of professional credits and development. So for example, let me give you a very specific example. Many of the training videos and continuing professional education credits for nurses, that content is actually coming from the UK or the US. And it's not to say that the standards or the content isn't valid. What I would say is, how relevant is it to the situation in, for example, Kenya and the nurses and in the rural clinics? Right. So if there was the support to build kind of a YouTube channel that I could have nurses and doctors and lab technicians develop short courses on this type of YouTube channel. However, I would make sure that I work directly with the parastatal agencies, for example, the Nursing Council of Kenya, who handle the regulatory aspects of quality assurance as well as professional assurance, to make sure that that content is vetted and approved. So you're not creating content for content. What you're trying to do is to create localized relevance using localized expertise, but then also attaching that to your professional development that's accredited.
So there's value to all of that. In other words, people can watch and they actually get some credit or some points, or they get some acknowledgement of their skills, of the skills that they've gained. Right. Interesting. Now, I mentioned you're far away from home. You're from the United States. You were born in Korea, but you grew up in the United States. So how is it that you went to school in the UK, in Canada? You're living, as I say, in Kenya. What has inspired you to have such a kind of international career, and in an area that is really quite challenging? I mean, international development, and not only that, but development work right at the ground level.
That's a very good question. So as I think in many of the pathways that we end up going down, it's not necessarily a matter of choice, but opportunities and just having some flexibility And so and I think this ties back to also women entrepreneurs in the article I wrote, is when you have stability both with family or finances and opportunities, you actually have the power of choice, right? And so I've been very fortunate to have a very good network of friends, family who've been very supportive, but I've also had opportunities which aren't easily given, and some of it has been pure luck, right? In terms of this specific work in Africa, it came about from my time at the World Economic Forum, and one of the projects that I was leading was on innovation in health service delivery. And so we looked at about 23 different countries, including the US and Canada and such. And the very overarching findings was that innovation and impactful innovation, because there's incremental and procedural innovation, at least in the health services, India at the time was, and still is, I think, a very innovative place for these services. One of the case studies said that one is you have great need, but the aspect of great need is that it's very recognizable, it's accepted as being arduous, and that the willingness to accept that if we can improve this, the impact can be quite great. Mm-hmm. And then secondly, in that area, you need talent, right? So it's not as if you can parachute coffers full of money and then expect to make sustainable impact. So you need local talent. And of course, that can be augmented with specialists and such, but you need a base core of talent. And then I think what's most important here is an enabling environment where you have both political, civil society, and professional organizations that are willing to, at least on a pilot process status, or if you're going to change regulations, enable the organizations to innovate, to experiment a little. And of course, you want to make sure that you're doing no harm.
Right.
So when I took those three aspects, I thought, well, India seems to be doing quite well in that. And so I thought, wow, Africa I think Africa has the same set of challenges and assets in that regard. And so that's what led me to the work here, and also some opportunities with the Johnson & Johnson Foundation programs that I had been exposed to at that time.
Right. Now, you're about to head back to the United States at some point soon. We were talking about potential for vaccines. I guess the United States. I don't know when the last time you were back in the U.S.
When it was just very recently. I was I was there for Christmas, but I hadn't been back prior to the COVID outbreak.
Yeah. Well,
so it's been about approximately a year.
What are your thoughts about the Asian American, the racism against Asian Americans at this point? That's been in the news and been much debated in recent weeks. What are your thoughts about that situation?
I'm sorry, could you repeat that?
Yeah, what are your thoughts about the anti-Asian American racism that has been much debated and discussed in the United States right now in recent weeks?
Well, I think that that's the power of language and nomenclature, right? So using terms like the China virus and things is problematic in itself, right? So the language and the communication pathways, and particularly in very high stressful situations, there's going to be some level of anxiety, both for the parties that are described and then those who are listening, who again also have some of their own anxieties and precedences and prejudices. And so, first of all, I think it's very, very unfortunate. I think that just having seen this from Africa, what's happening in the US,
Right.
honestly, I still am a bit befuddled by gobsmacked by the whole thing. I just never thought that I would see this level of response, for lack of a better word, and particularly, these levels of violence. But I really don't have an answer. I think that the ability to communicate information that's actually evidence-based, that as much as it can be unbiased, but that opens up the opportunity to discuss. But the polarization of what I read about anyway in the government, and certainly what I've seen when I was back in the States in terms of societal norms, is really disarming and very alarming to me.
Right. Well, Michael, thank you very much. You've been very generous with your time. It's been great to catch up with you, and keep doing what you're doing. It seems I know that you've had a lot of obstacles and difficulties to overcome, but you look well, and so that you're not the worse for wear, as it were,
thank you so
for all
much
for all that you're doing. So thank you very much for sharing the insights, which I think, for our audience, here in Asia, I think it's important because so many issues that we've talked about really resonate here in this part of the world and many other parts of the world, particularly the issue of promoting women in enterprise, in entrepreneurship, particularly in the healthcare sector, where many of the workers in healthcare are indeed women, and they are a resource that are important, but often underutilized, in the sense that when we design healthcare systems or lay out processes, we don't often involve them in the design and the creation of these of healthcare services. So this is an important message, I think, that you're bringing.
Thank you so much for the opportunity to contribute, both in terms of the writing and the ability to re-engage with you over this call.
Yeah. So great. Thank you so much. So I commend our readers and listeners to Michael's article, which is on AsiaGlobal Online. Go visit our website, AsiaGlobal Online, and the Asia Global Institute website. Follow us on social media, Facebook, Twitter, LinkedIn, YouTube, you know the drill. And thank you again, Michael. It's been lovely to see you.
Pleasure. Thank you again.
Thanks.